everyone. In this episode, I'm going to be talking to you about concierge nursing. My name is Nnamdi. I've been a nurse for over a decade, and in that time, I've worked in different settings from ICU to ER to basically taking care of geriatric patients all along. And I've accumulated a lot of experience, some good, some bad. But in relation to concierge nursing, I started to ask myself certain questions like, do I want a simple system for starting an independent nursing business? I was starting to notice that I became very frustrated with working for institutions, hospitals, or corporations that didn't value my opinion. I started getting very overwhelmed with the level of work and the stress associated with the bureaucracy as well. Um, and so I started to look for an alternative. What is the other option? There's a lot of information online. It gets overwhelming. The question of how do I practice nursing independently, getting rid of the middleman and being able to provide care for my patients. How can that be done? And the concept of concierge nursing as a business uh, showed up, but I wasn't very clear on how to get help to start this particular type of business. So as a nurse, if you're looking to get away from a volume driven type of care, or the type of employers that hire a bunch of nurses and don't really care about the individual, and all these other healthcare networks, this might be the solution for you. So, what is the anatomy of a concierge nursing business? What does it mean? Why do we need to learn this? It's necessary so you can see what's possible. What you end up doing might be the same as I described in this video today, or you might choose to do something different. You may choose to start a nursing concierge. You might also choose to go the route of an online business, or you might also choose to do something completely different. It's up to you. Today you're going to be learning and which option, and you can make that informed decision. A concierge nurse is typically self-employed and provides personalized care to a patient on a subscription basis. Think about your subscription services, your Netflix, maybe even mechanic, or whatever the case may be. When you're paying, whether it's monthly subscription or annually subscription, you've made the payment and you get the service. The nurse goes to the patient so they don't have to enter a hospital or make an appointment at a clinic. The patient doesn't pay for every service since the nurse works on a retainer basis. The patient also doesn't have to pay for every service since the nurse works on a retainer, and the fee that's already been paid is the same amount on a regular schedule. Whether you need the nurse for one day or you need the nurse for every single day throughout the month, you've already paid that one fee. And sometimes there might be an additional cost depending on different circumstances or emergencies, but that's on individual case. But the concept is you pay a subscription fee and you get your nurse whenever you need it. And nurses can come from hourly, they can choose from hourly, monthly, or yearly plans for their individual clients, depending on their clients' needs. The goal of a concierge nurse is to make sure that the patient has access to the care no matter where your patient is. Your patient might be in a home or in a public setting, or they might even be at a resort on vacation with friends or family, and the nurse goes to the patient. The nurses who want more control over their work lives may find concierge nursing career ideal for their scenario. Like I said, I've worked for different in different settings, whether it's for a hospital or for a home health agency or for registry, staffing agency. The same problem, I kept running into the same problem where we were understaffed, underpaid, and the nurse's opinion was not, the nurse was not treated as a partner in that relationship. It was more of a servitude where the agency or hiring entity dictated all the terms, and the contracts were not did not allow the nurse to foster and to even build a long term equity or long term interest in the business, and that can take a toll in the nurse. And you keep hearing stories of nursing shortage and nurses completely abandoning their careers to go into different fields. And I find it that there needs to be a solution to this, and that solution may be concierge nursing for you. And so pay attention. While the traditional fee-for-service medical model has been around for decades, it's beginning to obviously show its age. It's just not working for a lot of people, especially people who prioritize flexibility with their time and a good work-life balance. You may find that with the advances in technology and changes in our society and the demands of our individual patients as a whole, there are now more options that are available than ever before. A concierge nurse will work independent. They already have their license as an RN, licensed in the state to practice. They've already taken their board exams and they've already been licensed. And you're not working for an agency, you're not working for a hospital or even a physician's office. The concierge nurse can offer any service that a patient requires, so long as it is within the scope of the nursing practice. This is important. A lot of new nurses or a lot of nurses just don't even know that they are the product. When you go through school, the way nursing school is designed, it teaches you to be an employee. It doesn't teach you to be independent or even provide the idea that you can set up your own business. At least when I went to school, that was the case. That might be different now in some of the newer nursing programs. But this video is meant to inform you that you, the nurse, you can venture out on your own. As long as you're practicing within your scope of practice, you can accept private pay, and you can provide the same level of service that you were providing in that hospital, but you can provide it directly, eliminating the middleman, and you can provide it direct to your patient. You can provide customer service at any point. Whenever your patient needs you, they can call you. You can meet up with them. It allows you to actually take care of your patient on a more in-depth level where you're researching. I know for me, one of the things that I valued about it is I can take my time to research the patient's care and invest in these individuals' well-being versus just treating the patient as a number. Because when you're working for an agency, they just want to load you up with more patients because their goal is to maximize profit. So they load you up with more patients. They don't care about your time. They don't care about your well-being. They don't care about the quality of service to the patient. And everyone loses in that scenario, except obviously for the agency who's making money from it. But nursing concierge might be the solution for you. What kind of patients do you take are fit for this type of business? Your ideal patients are usually people who value their health. They live an active lifestyle and they want to improve their current condition so they can focus on their priorities. They also want to be actively participating in their own treatment. So the initial visit is very important because it's a time of discovery where you as the nurse will assess if the relationship with that individual, with that patient is a good fit. Not all patients are a good fit for this type of business because you might run into patients who don't really value their health and they'll drag. It might be a drag on your business. Just like to say, in any type of business, all customers are not your customer. You want to identify your audience and you market directly to your audience. So services offered include IV infusions. You can be a medical escort and travel around with your patient. You can provide wound care and be a wound care nurse. You can provide palliative services for hospice. You can provide private care in a hospital or facility. You can provide IV infusions. I did a lot of IV infusions in patients' homes, IVIG, antibiotics, steroids, whatever the case. You can provide nursing concierge for IV infusions. You can provide post-op care, wellness support, patient advocacy. Any specialty available to a nurse or a nurse practitioner is also available to the concierge nurse. You don't have to obtain an advanced degree to be a nurse concierge. Your RN license is good. You can get started from that point. So now the question is, how do you become a concierge nurse? The first step, of course, is to get your nursing degree. If you don't have a nursing degree, that's the first step you want to go through. Ideally, you get at least an associate degree to become an RN. You can also choose to go from an RN to a BSN and obtain your Bachelor of Science in Nursing. And this will significantly improve the opportunities and the more money that you can bill for your services. You also need to get licensure in your state. Some licenses are compact, which allow you to practice in multiple states without going through the hassle of getting individual license for individual states. The licensure requires you to take a board exam, which is a national board exam, the NCLEX. If you're already an RN, you're familiar with this, but for new nurses or people looking to get into this career, you're going to need an NCLEX license to take the NCLEX. From there, the qualifications to become a nursing concierge, it starts to vary because there's many different specialties, like I mentioned earlier, that you can go into. The more education you get, the more advanced or the specialty services that you can provide. Becoming a nurse practitioner, which is an advanced degree, it does require you to go through a graduate degree, a graduate school. It may be worth it because it allows you to prescribe medication and offer advanced medical services. While in the US, nurse practitioners must have an additional 500 hours of clinical training. And once you get the necessary training, you can decide whether to open your own concierge service or work with other nurses and physicians. You can also work with organizations or nursing service and have patients assigned to you. So this is the short form of concierge nursing and how to become one. I wanted to give you an idea and introduce you to this concept. Over the coming days, I'm going to be making more content around this subject, and I'm also going to share with you my experiences over the years. I want you to know that you can bet on yourself. It's a fallacy that you're not capable of achieving on your own. Whenever you believe it, if somebody else has already done it, you too can do it. A lot of us lack information, and I'm not even going to just say information. I'm going to say correct information, because there's a lot of garbage out there, whether it's hearsay or online, or the norm is to be an employee. But some of us are critical thinkers. Most nurses, to even be successful in this career, you have to be a critical thinker. So you have to be able to practice independently without being micromanaged or being supervised. So if you're that type of person who knows that you're capable of venturing out and going on the adventure of finding fulfillment in your career, this information is for you. Watch this video over and subscribe to the channel, because I'm going to be bringing you more. Again, my name is Nnamdi. It's been a pleasure bringing you this content. Thank you for watching.